Estratificação do risco da DPOC, risco cardiovascular são temas muito discutidos aqui no RS. E eu tenho a honra de ter ao meu lado o professor Bernardino Alcazar Navarrete, da Universidade de Granada, que gentilmente parou para conversar conosco a respeito desses assuntos, onde ele é professor aqui no evento. Thank you for your kindness, Doctor.
Thank you very much for inviting me.
We are talking to Brazilian pulmonologists in our website, Pneumo Imagem, and about the stratification of COPD and prevention of COPD. Could you explain for us?
Yeah, this is really a hot topic right now in COPD because, for many years COPD has been approached in a reactive approach in the treatment, okay? So patient, for example, comes to your clinic, he has symptoms, you prescribe inhalers. Patient has exacerbations, and then you prescribe other inhalers. And in fact, we are good at doing that, but not at detecting and spotting which are the patients who are going to get worse in 5 years. And I think this is a key point because it changed a lot the way we think on COPD, on a more preventive approach. So if you think on cardiovascular area, the cardiologists pick their patients and pick the ones who are at the highest risk for bad outcomes in the future, and then they prescribe treatments to prevent these events, not to wait until the event has come, but to prevent, for example, a myocardial infarction. And this is something that we are going to see in COPD field in the next years, probably.
Okay, and the cardiovascular risks in COPD.
Yeah.
Well, what's it talking about?
So right now another hot topic in COPD is cardiopulmonary risk. That means the risk of having pulmonary events, for example, exacerbations, which we all know that are bad for patients. But also we have known for many years that people with COPD have comorbid cardiovascular disease. What we are right now taking into account and acknowledging is that if you, for example, have exacerbations, then you will have an increased risk for cardiovascular events after the exacerbation. So, for example, you have a severe COPD exacerbation, you get admitted to the hospital, and by the next month and until a year, you will have an increased risk for having myocardial infarction, heart failure, stroke, and so on. So cardiopulmonary risk is the combination of both the risk of having exacerbations and also the risk of having cardiovascular events due to COPD, but also due to COPD exacerbations.
This risk is higher at the first exacerbation or after just 2 or more exacerbations?
So just one exacerbation, even moderate one, put you at risk. Of course, the risk is higher in those patients who are admitted, those with severe COPD exacerbation. That's the highest risk. But even just one exacerbations puts you at risk of having this cardiopulmonary risk.
Thank you very much for your kindness, Doctor. E obrigado você que acompanha o RS 2024 pelo Pneumo Imagem, porque você sabe, RS 2024 é aqui no Pneumo Imagem.